And welcome to Health Talk on GMC TV. My name is Rebecca Caleb Minor. Today we are commemorating the World Breastfeeding Week, celebrated every month, every August 1st to 7th. In this edition, we are going to talk about exclusive breastfeeding, and its importance. Breastfeeding remains one of the most powerful and cost-effective interventions for promoting child survival, optimum growth, and lifelong health. As the globe marks World Breastfeeding Week, themed Prioritize Breastfeeding, Create Sustainable Support Systems, the spotlight turns to how the society can build enduring support systems at home, in healthcare facilities, workplaces, and communities to empower mothers to breastfeed successfully. In Nigeria, while more than 90% of women have breastfed at some point, exclusive breastfeeding remains alarmingly low, with only 1 in 3 babies receiving breast milk exclusively for the first 6 months. Early initiation has also declined from 42% in 2018 to 36% in 2023, according to the National Demographic Health Survey (NDHS). Today, on Health Talk, we engage with Dr. Mercy Raymond Gapsiso, a pediatrician with the Federal Teaching Hospital, Gombe. Ma, you're welcome to this edition of Health Talk on GMC TV. Thank you for coming. We also have a nursing mother and her baby, who will also feature in the program to share her experience on exclusive breastfeeding and the breastfeeding process as a whole. However, I'm starting with Dr. Gapsiso. Doctor, welcome to GMC TV once again.
Thank you, Ma. Thank you for inviting me.
So we'll start. What does optimal breastfeeding mean, and why is it crucial in the first 1,000 days?
Yes, optimum breastfeeding means breastfeeding babies exclusively for the first 6 months of their life. Then at 6 months, introducing appropriate and adequate complementary feeding. And then continuing breastfeeding until at least 24 months of age. If that is done for any baby, that is called optimum breastfeeding.
Okay, you made mention of 24 months. I know that there is, what can you explain about the 1, 6, 24 of optimal breastfeeding, and what each stage is, why each stage is so important?
Yes, the breastfeeding exclusively is expected to be initiated within 30 minutes to 1 hour of life of every newborn. And that is because early initiation of breastfeeding helps to establish lactation. If breastfeeding is not initiated within the first 30 minutes to 1 hour, the mother runs the chance of having breastfeeding or lactation failure. That is why many mothers agitate and say, oh, I'm not lactating very well, and my breast milk is not coming, because most mothers practice prelacteal feeding. What do we mean by prelacteal feeding? Some give glucose water, some give Zamzam water, some give a lot of things before initiating breastfeeding. And some mothers, following delivery, they will say they are very tired, that they want to rest. So you see babies come at 24 hours of life, they are yet to be initiated at breastfeeding. So that causes lactation failure. So then if breastfeeding is initiated within the first 30 minutes to 1 hour, that's the one, then it should be continued for the first 6 months of a newborn's life, because of the benefits that is derived from exclusive breastfeeding. And then at 6 months, if a baby is breastfed exclusively for that first 6 months, it gives a good start to their nutrition and growth, and it ensures that they grow optimally and they don't fall ill frequently, having diarrheal disease, pneumonia, and other illnesses that are seen before the first 6 months of life. And then at 6 months, mothers are supposed to be counseled to commence appropriate complementary feeding. What do we mean by appropriate? Some mothers, at 6 months, babies should be given semi-solid feeds like pap. Some go on to buy cereal-based complementary feeds like Cerelac, Nutribon, and other things. So, but it depends on the options that the mother picks. Then that breastfeeding should be continued both day and night. And when we say exclusive breastfeeding, we are not saying that the mother will breastfeed during the day only, and in the night she will sleep and forget about the baby. No, she should breastfeed both day and night. That is what we call an on-demand. Because some mothers also in between, they give water. That's not exclusive breastfeeding. When you say exclusive, it means that it is only breast milk and no water, no other fluids except medicines when it is indicated. Then that breastfeeding should be continued till 24 months as mutually agreed by the mother and the baby. Because some mothers, of course, in mothers, but with the support systems in place, that mother can achieve that optimum breastfeeding up till 24 months.
You made mention of 30 minutes at delivery. We have instances where women say the blood, the breast milk isn't coming out. So what happens at that period?
You know, the volume of breast milk that the baby needs at birth is very minimal. And the first breast milk that comes out, we call it colostrum. It's rich in proteins, it's rich in fat, and it has it serves like the first immunization because it has a lot of antibodies. What are antibodies? They are substances that help the baby to fight diseases, especially those that the mother has been exposed to. So at that first day, that little volume that comes out is yellow, is thick, is adequate for the baby. And once it is continued, within 24, 48 hours, at most by 72 hours, the mother will be having so much breast milk that it will be leaking and even wetting her clothes. So that is why we say that starting within that 30 minutes helps to establish lactation, because lactation, there's a connection between the breast and the brain. And once the baby suckles, it sends signal to the mother's brain that, oh, you need to manufacture breast milk, and the breast milk will start flowing in sufficient quantities.
Okay. You made mention you have listed some benefits. May we also know more benefits of this breastfeeding that we've been discussing?
Yes, in terms of growth, the child will grow optimally, and then it prevents babies from having recurrent diarrheal disease, because it's one of the top killers of under 5s and infants. It also helps to prevent pneumonia in children. It also helps to prevent ear infection, what we call otitis media. Breastfeeding also helps in making the baby intelligent, what we mean by cognitive abilities of the baby. Babies that are breastfed exclusively, research has shown that they are more intelligent in their cognition than babies that were not breastfed exclusively. That is for the baby. Then in later life, it also prevents the baby from having allergic diseases like asthma, diabetes, and obesity in the future. Then for the mother, because some women can bleed following delivery, what we call postpartum hemorrhage. So early initiation of breastfeeding helps in preventing primary postpartum hemorrhage in the mother. It also gives the mother the satisfaction of feeding another person, and it prevents her from having ovarian cancer and breast cancer in later life. So for the community, of course, it saves a lot of cost, because if you look at the cost of infant formulas on the market, it is not affordable to every family. So it saves the community costs. So it's cost effective.
Okay. Um, what about the father? Because most often when we talk about breastfeeding, we always say the benefit is to the mother, the child. Does the father have any benefits when it comes to breastfeeding?
Yes, it also saves the father cost, his pocket, if he has to buy infant formula. A baby that feeds well will finish one tin in 3 days, and one tin ranges between 7,000 to 14,000 naira on the market depending on the brand. So imagine spending 7,000 naira 3 times per week for 1 month. You can imagine the cost. So it also saves the father some costs.
Okay, some women feel that the breast milk isn't still sufficient. So you see, I know I've been to the hospital and I see where the grandmothers even come with water, bottled water, to feed the child. And when I confronted one of them, they said it's because there's no breast milk, that the breast milk isn't sufficient and the baby keeps crying. Are there factors like that leads the breast, or is it just our thinking?
Yes, those are misconceptions that are related to breastfeeding. And that is why we need to debunk it. We need to create awareness in the community, even among the health workers, so that, and then there's this lactation management trainings that are ongoing, that health workers should be sponsored and taught how to support mothers during breastfeeding so that they can initiate breastfeeding, maintain breastfeeding, even when they are separated from their babies for say 2 weeks. They can still be taught how to maintain lactation so that when they come back from a journey, like maybe they want to embark on Hajj, they want to embark on pilgrimage, they can be taught how to maintain lactation so that when they return, they can still establish lactation. So it is a misconception within the society which has to be debunked.
But are there special cases where women, are there special cases where
Yeah,
some women don't even see the breast milk?
yes, it's rare, but there are. Like if a woman bleeds so much and she has problem with her brain, or bleeds into the area of the brain that controls the hormone that helps in producing the milk, then that can happen. But it's rare. It's rare. And that is why the consulting with pediatricians and obstetricians can help to establish whether this is a real lactation failure or it is just a misconception. I know I've met several women that say, oh, when I deliver, the breast milk doesn't come. So it is all those practices of not starting breastfeeding, initiating on time. Then when they initiate, they give it erratically because God has so made it that the more a woman breastfeeds, even a woman that has twins, triplets, can still breastfeed exclusively because it is as the baby demands, the baby is suckling on the breast, then the production becomes sufficient. So as long as baby is suckling, breast milk keeps flowing. But once there is an interruption in suckling, the brain now, it sends a signal to the brain saying, oh, this thing is not needed here. But as long as the baby is suckling on the breast, it sends the signal to the brain that, oh, you need to manufacture more, you need to manufacture more. Just like in economics, the law of demand and supply. Once there is demand, then there is bound to be more supply.
Are there certain food that the woman should eat before or after delivery for ensure that the breast milk is flows as it expected?
Yes, what we usually advise is that women should eat adequately and balanced diets because the manufacturing of breast milk needs substrates, so it is from the food that the woman eats. But there is no particular food. Once a woman feeds well, I know in traditional settings they say, oh, she should take potash pap, that's kunun kanwa. So, but all this, I don't think they are medically proven. Once a woman feeds well, she's well nourished, she will produce adequate breast milk. And the quality of breast milk also depends on the maternal nutrition. So that is why during pregnancy and during lactation, the mother should be provided with adequate nutrition so that her baby will get a quality breast milk.
You stated many benefits of exclusive breastfeeding, but in Nigeria it still remains low. What are the major barriers that you see in practice?
Yes, so some of those misconceptions I talked about earlier, that if a woman feels that she doesn't have enough breast milk, she's not motivated to breastfeed. And then sometimes our modern day women, they feel that, okay, when I breastfeed exclusively, or when I even breastfeed at all, that my breast will sag. So they will say, no, let the baby just take bottle formula feed. So they don't want to breastfeed. Then lack of training of the healthcare personnel is a great barrier. So I encourage that government, the Ministry of Health, non-governmental organizations, individuals should sponsor healthcare workers to be trained on lactation management and support. There are courses like that, and then maybe there are some others that are free online on lactation management. So if our health workers are trained, and especially our midwives, then those that are working at primary health care centers, because most deliveries take place at those places. So they will be empowered to support all women to initiate breastfeeding early, and then to maintain breastfeeding and breastfeed exclusively for that first 6 months.
We're going back to the rules now. What rules do the health professionals, like the pediatricians, the nurses, the midwives you made mention of, play in encouraging and supporting breastfeeding?
Okay. For us, we start with before we come to the pediatricians, we start with the obstetricians. So at antenatal, women are usually, and the public health unit, like in the facility where I work, the Federal Teaching Hospital Gombe, which is a tertiary center, the public health, they usually create awareness during antenatal visits. So they tell the women the benefits of exclusive breastfeeding, they discuss, they counsel them, so that they now decide. Even mothers that are HIV positive, I remember in the early days of HIV epidemic, mothers were not breastfeeding because the pathophysiology and the problem of mother-to-child transmission was not completely understood. But now every mother, whether HIV positive or HIV negative, they are counseled to breastfeed exclusively. So antenatal counseling. So at labor, during labor and during the delivery period, mothers are also counseled on their option of infant feeding. And if they decide that they want to breastfeed exclusively, they are supported to breastfeed exclusively. Then when they come for their follow-up visits during the postpartum period, the puerperium, they are also still counseled. We inquire about the fact that the child is either feeding exclusively or is not exclusively. We have had to counsel mothers to stop giving water or infant formula or practice mixed feeding. They give water, they give breast milk, and they give infant formula. So once we see those women within the first 6 weeks of delivery, they are counseled against all those practices that are not good for their babies, and they are told the benefits of exclusive breastfeeding. So the place of counseling and public health awareness cannot be overemphasized with regards to infant and young child feeding.
The position of a mother, does it play a role in breastfeeding? How she holds the child, how she stands or lies?
Yes, it does.
Milk?
It does. It doesn't contribute to the flow of milk, but it contributes to the comfort of the baby. You know, when the mother is breastfeeding, ideally the baby, there are different positions anyway, but the common one is that they put the baby on their arms with the head in the elbow, and then they are supposed to put the tummy of the baby should be touching the tummy of the mother. The mother should be well relaxed, sitting with her back straight, looking at the baby so that they maintain eye contact for bonding and to know. Then she now puts the breast into the mouth of the baby with the areola, the black part. Most of it, more than 2/3 of it, should be within the mouth of the baby, so that is called attachment. If the baby is well attached and is suckling well, there should be no sound coming out from the baby. The baby will be able to suckle well, so the breast will be almost completely in the baby's mouth. That is called good attachment and good positioning, and that will ensure that the baby suckles well and gets satisfied. And a baby that is well fed, you should notice that the baby will sleep for at least 2 hours at a stretch if a baby is well fed. But mothers come and say, oh, my baby doesn't sleep, my baby is always crying, this and that, because they are not well fed and they are not satisfied. Once they are well fed, they should sleep for a minimum of 2 hours.
So how is the breastfeeding like? The baby feeds on the one side, and there are some minutes that the baby should do and then move to the other side of the...
Yes. So we expect that if a baby is put on one breast, the baby should be there for at least 20 to 30 minutes, because there is this concept of foremilk and hindmilk. Foremilk is the milk, breast milk, that comes out first, and that is rich in water to help quench the thirst of the baby in the first 5 to 10 minutes. Then if the mother subsequently continues breastfeeding, the high proteinous breast milk, the one that is rich in fat and protein, now comes at the hind part, that's the hind milk. So that, if it is given up to that 15, 20 to 30 minutes, the baby is taking a well-balanced breast milk. But if the mother just put the baby on one breast for 5 minutes, take the baby to the another breast for 5 minutes, the baby is just drinking water, and you will see that that baby will not be gaining weight adequately as it is expected.
You made mention of twins. Mother of a twin can also exclusively breastfeed
Yes.
children. I'm yet to see a mother doing exclusive breastfeeding. I remember one mother said, can't you see already I've emaciated? Please, could you enlighten our mothers, especially those with twins, triplets, on that?
Yes. So for mothers that have twins, what they can do is, after feeding, they should use one breast for each child. When they finish, they empty the breast. Within like 1 hour, the breast will get filled up. And at that time, a baby that is well fed should at least stay for 2 hours without requiring to feed on the breast again. So between that time, the mother should express the breast milk and put it in bottles and store it in the refrigerator. Once the baby wants to feed, she can now bring it, get warm water, put the bottles into the warm water, so that she brings the breast milk to the body temperature. And when the breast milk is gushing out, maybe leaking, her breast is full, she now expresses it and keeps it in the refrigerated if she have access to light, because a breast milk that is expressed either in a cup or in a bottle should not stay for more than 2 hours at room temperature. That's between 27 to 28 degrees centigrade. So the best thing is to refrigerate it. And then for that mother, I know we have not reached the support yet. For that mother, if she has her husband or any other caregiver, she can now sleep, because optimal rest is also important for good lactation. Because if the mother is well rested, she will produce enough breast milk, so she can express them, store them in the refrigerator. When it is time, she can bring them and feed the babies. I know it can be challenging, but with adequate support systems, it is doable. Many women have done it before.
Okay, what policies or systemic changes do you think would most effectively improve breastfeeding practices? in Nigeria?
Okay. One of the things is that the duration for our maternity leave, it's currently 4 months. I think that with a change of policy to 6 months can help, because that will ensure that working mothers are able to breastfeed exclusively for 6 months without coming to work. I know this is not easy, but for the government it's doable, considering the long-term economic benefits. When you do the cost-benefit analysis of exclusive breastfeeding, optimum breastfeeding for up to 12-24 months, the government stands to gain more, because a child that is malnourished, the government will end up spending on that child. So why don't we invest in breastfeeding for the future? Then at workplaces, both private and public places, there should be safe spaces created for mothers to breastfeed, like crèches. If you go to several government organizations, several private organizations, there are no such provisions for even if it is just a comfortable room where the mother can take 30 minutes break in between work to breastfeed. They are not available. So the government has to be deliberate and intentional in creating crèches, safe spaces where mothers and their babies can take breaks and breastfeed. Then some organizations have policies that discourage mothers from coming to work with their babies. I think that the government need to discourage such organizations and even put sanctions against such organizations, because of the benefits, both the short and long-term benefits of exclusive breastfeeding. The government should do more. Then the government should invest in training of healthcare personnel on lactation support and breastfeeding management. If that is done, I believe that. And then another thing is that public health campaigns like this 1 week of exclusive breastfeeding is not enough. It should be a year-round activity that should be incorporated into our antenatal clinics, into our postnatal clinics, everywhere. Breastfeeding, fathers should stand up and become champions, because if males are involved in the issue of exclusive breastfeeding, I believe that we will achieve a lot.
Okay, well viewers, if you're just tuning in, this is GMC TV Health Talk, and today we are discussing breastfeeding. It has saved babies, it has saved mothers, it has saved the community. And we have here Dr. Gapsiso, who has been discussing on the benefits of breastfeeding from 1, 6, and 24 months. And we have heard that breast milk, the first breast milk, which is called the cholesterol, saves the baby. It's like a vaccine, the first vaccine of the child, and this should be initiated 30 minutes after birth. That means at the labor room.
Yes.
The child should be introduced to breast milk. So mothers, if you are there and you feel your breast milk is not coming out, perhaps there are some certain things that it's not that you don't have breast milk. You do have a breast milk. It is natural from God, and you can breastfeed your child exclusively for 6 months, and it will prevent the babies from diabetes, and it will improve the reasoning of the child, the cognitive reasoning. You see your child, that's why you see children brilliant in their school. If you ask the story, they will tell you, the mother will tell you that I exclusively breastfed my child, and even after that 6 months I continued with complementary feed and specified according to a nutritionist or according to a health specialist. Not just you just give protein all through, not that you give carbohydrates. There are required nutritional diet that is needed for every child, and that's the doctor has explained. So I'm going to move to the mother here, Mrs. Amdor Bala, who has exclusively breastfed her child for 6 months. She's going to share with us her experience. Mrs. Mela, tell us your experience. Share with us. Let the public
Thank you for having me. It's really a privilege for me to share my experience on this platform. I know it's reaching a lot of women. Breastfeeding can be quite challenging. Breastfeeding is a reward after that 9 months. Holding your baby is a joy. Now we have a lot of women that went through the 9 months but could not hold the baby and breastfeed. Now it's another reward, holding the baby close to you and now feeling it close to you, that tiny life that you carried for that 9 months, you're able to bring it close. It's quite rewarding. Now breastfeeding as a mother and as a working mother, it's quite challenging actually. And the joy is when you see the baby growing well and healthy. Now, with the support system around you, I want to just thank God and thank my husband and my families too for giving me that support during the breastfeeding period. And also, I want to encourage mothers looking at when you're pregnant, visiting the health facility during your antenatal plays a very vital role.
Okay, Mrs. Mela,
Yes,
you have breastfed your child for 6 months, and we
yes,
heard the doctor talk about benefits.
yes.
Was that manifested in your child?
I, I don't have to tell you, if you can carry this baby and weigh, the weight of the baby speaks about what she has taken as a baby during these 6 months. I exclusively breastfed her. Now, I see the bonding. We communicate. There are things that even if I say it with my mouth, if I talk to her, she reasons, she pick up easily. I see the benefit of it, the way her brain is developing and the energy she carries around. She's not prone to little illness, this diarrhea and other things. She's not, I've never visited hospital in the name of any sickness or anything. I have never. Since the day I gave birth, except for immunization and my postnatal care. But I did not go to the hospital because she is sick or anything. There's no any health challenge. And God helping us, I was able to go through the trainings we had during the antenatal really plays a vital role and it has helped me. Now, adequate rest and nutrition also helped me at the course of this journey. It was not actually easy, but rest and nutrition really helped me a lot. The baby cannot take adequate nutritious food if I did not take it. So there's no magic in it. What I take, I give it to the baby through the breast milk. Thank you.
So, what were your biggest challenges and kind of support that maybe I know you made mention of your husband? What were your biggest challenges?
Wow. One of my biggest challenges was as a working mother. After that 4 months of um, break, I have to resume back to work. Now going back to work,
Okay,
it's quite challenging.
your maternity leave was approved. You went for
Yes,
maternity
my
leave.
maternity leave was 4 months.
Okay.
Now, the 4 months, I felt it was not really adequate for me to bond with my child and to do this exclusive breastfeeding effectively. Now, it's quite stressing. Now, leaving her at home, expressing the milk, you know, I was just having it in mind, considering the hygiene behind it, the people I left behind. I'm always conscious of, have they really done this accurately? Did they feed her properly? Or did they just leave her for a long time before feeding her? I'm always having a divided mind in the office. So it's quite challenging balancing the work and now the baby at home, you understand. So um I I just want to advocate or now request the government with the recent policy now increasing it to 6 months. It will give us adequate time to exclusively breastfeed our children. Now, to that very point, I think when we are introducing the complementary food, it will be easy. Now, leaving them at home, it will going to be very much easy for you to be focused on your job. Now, giving out your best too.
Okay. You said you have to leave your child at home. Were there not crutches or something that you could take your child while at home and then breastfeed and come back in your
Actu-
workplace?
Actually, there is no crutch. There's no crutch in our offices. Now, when you carry your baby to the office, sometimes now to breastfeed in the public, you have that self-conscious of now looking at the nature of people around. There's a way they frown, they stare at you. Um, they take off their eyes. It's not looking normal. It's not like a welcome idea. You breastfeeding your child in the office. Sometimes you have to resort to maybe going into the car. If you're not privileged to be mobile, you like take your colleague's key, go into the car and breastfeed. Or sometimes like me, there was a time I have to lock myself inside the office, and now being conscious of the movement around, let me see how I can breastfeed. And I find out that this distraction, the baby cannot concentrate and suck properly. The baby cannot feed well. So we are advocating and now requesting the government should implement this. It will go a long way in helping seeing how we can now bring up our children, now breastfeeding them very well, having a healthy children that can make impact in our society. It will reduce this it reduces costs. Now it's cost effective. Now it reduces the high rate of having children going out to cause violence in the society and other things like that.
Okay, prior to the um, delivery, did you receive any education, either from the healthcare provider or from the community, on how to breastfeed your child? Was there any education given to you that aided you in the course of breastfeeding your child?
Yes, there was. During our antenatal visits, there are sessions in which we were taught how to, more especially the new time mothers. Now, when she was talking about bonding, good attachments, now these are things that are quite important. We were taught because some mothers complain about bloating stomach, and we're meant to understand that these are sometimes the baby begins to will not suck properly and air will be going in. You understand? That causes bloating stomach, and it's not healthy for the child. So I understand now good attachments. I also understand um how to how to take care of myself. My hygiene is quite important. And now I also learn about nutrition. Now, the kind of food I eat, I mustn't go on expensive food. We have local foods around. Now those local food, now we look into veggies, we look into protein and other things like that. So we are encouraged to feed well so that we can feed our babies properly.
Some others say they experience pain when they are breastfeeding their children. Did you experience that stomach pain? Because I see women. Did you experience that during the course of breastfeeding?
Actually, I did not experience anything. This is my third baby, and throughout my journey, the first, the second, and the third, I didn't experience any of such.
Okay. Well, viewers, you've heard that the doctor was not just speaking science or speaking her profession. It's actually practical. It's real. From the mother, we're told this baby has never been to the hospital except for immunization, because she exclusively breastfed her child and ensured that she took care of herself, ate nutritious food, and she told us that it must not be expensive. We all have them in our homes. You can grow them in sacks, in bags.
Yes.
You can grow vegetables to take care of our babies. And we see that her story has told us that exclusive breastfeeding your child all through, it's real, and it's possible, and it's doable. Any mother can do it. She has done it. Mothers can also do it. Doctor, I'll come back to you. What are the myths and misconceptions that you hear people complain about when they tell you that they have problems breastfeeding their children?
Okay. Within the community, the mothers will say, oh, that when they deliver, that they don't have enough breast milk, some will even say that exclusive breastfeeding, that thirst will kill their babies. Why would they, especially during heat season between February to April, mothers will say no, that their babies will die of thirst. But the composition of the breast milk has 90% of water, and if mothers are, these myths and these misconceptions are debunked within the community, I think we can go a long way. And then some mothers also say that their breast milk is not good, that when the babies are taking the breast milk, that they are not growing. So, but I tend to disagree with that, and that is why the place of counseling, going to the hospital if mothers are having challenges with breastfeeding. The puerperal immediate postpartum period can be a very, very challenging period for most women, and they need all the support they can get from the family, especially the spouses. If they have other members of the elderly women, experienced women that are there with them, if they are supporting them, I think that with adequate support, all these challenges can be overcome. There is no, even mothers that adopt babies that they didn't deliver by themselves, they can still be taught how to lactate and even breastfeed their own babies. So for a woman that carried pregnancy for 9 months, we always disagree and say no, every woman, at least 98% of women will produce their own breast milk. And then with the advancement in technology too, they are beginning to be considered. So maybe the government can bring change in policies where there is breast milk banking. Mothers that have excess breast milk, they can put it in the bank, just the way you keep your money.
Okay, like we have blood bank.
Blood banks. Yes, there are also breastfeeding banks. If you go outside the country, these are things that are well established, and there are guidelines and criteria. And for us in the Pediatric Association of Nigeria, we are beginning to consider all these things, creating guidelines so that it can even be run like a private bank, and it can also be run as a private facility like charity, where mothers that die during childbirth or delivery or immediate postpartum period, the families can go access breast milk that are banked and give their babies, and the babies will do well.
Mrs. Balam, I know mother-in-laws have great role to play in feeding children. What was your experience with your mother, your mother-in-law?
Actually, it's quite unfortunate. I lost my mother-in-law before I was put to bed. But my mother was around, her sister too. My mother-in-law's sister was around. So I think they have this pre-knowledge because they have children that are medical personnel, and they have that experience and they understand what exclusive breastfeeding is all about. And majorly what rings into our minds and is this issue of breast cancer. So it has sticked to their mind that once a woman did not breastfeed her child exclusively, now she is prone to breast cancer attack. You understand? So they have no option than to say, this your error, it's somehow. So just do it exactly the way the doctor just told you to do. Just go ahead and do it. So actually I was not having any challenge in regards to that. I am safe in that aspect.
But we've seen where mothers, I've seen where mothers give water to their children, to their babies, infants. So what advice do you have?
Actually, I saw one and I really frowned at it. Why? Because looking at this is just an infant, you don't know the source of the water, you don't know what chemicals were used in purifying the water, and it's too early for that infant to start getting such into his system.
In fact, I've seen a situation, doctor, where even the mothers give them glucose. The grandmothers give glucose.
It's actually very, very bad. Actually, I saw one and I really frowned at it. Now, you see, even the educated, we mothers, you find out that immediately you give birth to your baby, leaving the comfort of that hospital, coming back home. There are nasty things we do that are actually very, very discouraging. Now, the health, the hygiene around the environment in that room. Now, the things you use. Now, bringing those water, introducing it, it's quite very, very, very wrong. I know one of my first child, when I gave birth to my first child, I was not having breast milk immediately. But the contact, the nurses around me encouraged me. We kept on giving the baby, let the baby keep sucking. Now, what they told me is it stimulates my brain. Now, the brain will start when she was explaining, I said, she has finished everything, because that was what happened to me. That was what happened to me. I was in FMC. They kept encouraging me. They stood by me. They rallied around me. They didn't give me space. I was like, these are not my relatives, but they know what they are doing. They know what they are doing. They actually encourage me. And now, the more we do it, the more it comes. I saw it very small. I was thinking, this is not enough. But they said it's enough for the baby. That's what the baby needs for now. You don't know what the baby took when it was in the womb. So now that you're giving it, this is what the baby actually requires, and it's very important for the baby. So it's wrong. Introducing water, whatever it is very wrong. If there's any challenge you are facing during breastfeeding, now what thing you should do is to visit the nearby PHC. If you have any nurse around you, visit them, seek for counsel. It will go a long way to help you. The money you spend in buying drugs for this baby, it will reduce it. It will go a long way to reduce. Look at our economy today. Now, it will go a long way to reduce spendings on drugs, and you channel that energy to develop your family. Thank you.
Doctor, what is the consequences of giving glucose to an infant?
Yes, it's a bad practice, and it should be discouraged with strong words, because glucose, when it is given, the body will react by producing insulin. And insulin is like a chemical or a hormone, we call it, that mops up the glucose from the bloodstream and takes it into the liver. So once a mother gives glucose to her baby, the insulin will be secreted, it will mop up the glucose in the system, and then it will lead to low glucose in the blood. And that low glucose will affect the brain, because the brain needs glucose for it to function. All the systems need glucose. So if that glucose is mopped up and it leads to what we call hypoglycemia, low glucose level, that child can have affectation of the brain and other organs in the body. So that is why mothers that are watching us, please don't give glucose water to babies, because it is dangerous.
Okay, doctor, as we wrap up, what would you want our viewers to know about breastfeeding? Your final word to the people.
Yes. Breastfeeding is God's gift to us. We don't need money to breastfeed. It is cost effective, and it has numerous benefits. And once it is practiced as prescribed, as it should be, we will get the benefits, and we will save future generations, because we will have intelligent children that will contribute to the development of the society. Thank you.
Okay, Mrs. Amdo.
Yes,
traditional rulers, religious leaders, what's your word to them, your husbands and the community as a whole? What do you have for them?
Our traditional rulers, the government, our husbands. The word I want to give you today is to say a very big thank you for the support you've been giving your wives. And we want you to help us push this policy. Let there be extra extension of this month. Let there be 6 months break for every woman that has been put to bed, any working mother. Now, let there be an extension. Let it not be just 4 months, but it should be 6 months for proper exclusive breastfeeding. And we also call on you to advocate more, encourage these women. Now, psychologically, we need encouragement. We need you to give us a pat on the back and say, well done, you're doing well. Now, by so doing, it will give us more strength to put in more effort to see how we can do it more. Now, a woman is pregnant with so many things in her. Now, the more you give her love, support, and encouragement in the community, at home, you find out that she will give you the best, and the society will be the best place to be. You see proper training, proper upbringing. Now, lastly, I want to encourage women to this exclusive breastfeeding. It helps you during your child spacing. Child spacing, very, very important. Now, when you do that, it will go a long way to help you as a mother. Consider your rest. Mental health, very, very important. Rest well, take your body, treat your body very well, eat well, and give your babies the best, and the world will be the best for us. Thank you.
Thank you very much. Yeah. So viewers, as we round off this important conversation, one thing is certain: breastfeeding is not just a mother's responsibility. It is a collective effort of all in the society, from the government, the public, the health practitioners, the religious leaders, the fathers, mother-in-laws. It is a responsibility of everyone to ensure that breast milk is given to a child at birth to 2 years as prescribed by health practitioners. And from our expert, Dr Gapsiso, we've learned that breastfeeding is a powerful, cost-effective investment in a child's health. And from Mrs. Amdo, we've seen how real-life supports make all the difference. We must do better by strengthening health systems, ensuring paid maternity leaves, creating breastfeeding-friendly workplaces, and investing in breastfeeding education for all. To every parent, health worker, employer, and policy maker, your support matters. Together, let's prioritize breastfeeding and create sustainable support systems for a healthier future. Dr. Gapsiso, thank you for coming to GMC TV Health Talk. We had an insightful discussion, and I believe our audience and viewers are enlightened. Mrs. Amdo, thank you for coming.
Thank you so much. Thank you for having me. Thank you.
Thank you for staying with us. Until next time, stay healthy, stay safe, take care of your children.